Hey everyone, this is Paul from Ortho Eval Pal. I'm here with Brandon today. We're going to be talking about his right knee pain. We're going to do a straight up cold evaluation and with really no significant history. So we're going to go from top to bottom. We're going to ask some questions. We're going to do a physical exam. We're going to talk about kind of how we're going to manage this knee of yours. And so we'll go from there. So first of all, Brandon, thank you for doing this with me. I really appreciate it. It's great to have real patients with real diagnoses to show folks out there so we can kind of learn a little bit better and how to be a little more efficient with our evaluations. So first question I have, first of all, is how old are you?
I'm 27.
Okay. And so how long has your right knee been bothering you in this last episode of discomfort?
So roughly, I'd say about month and a half, 2 months.
Okay. Anything that started this up? Any new activity or anything like that?
Yeah, so I started training for a half marathon, which I'll do this summer. I've upped my running, length of running, trying to get up to obviously 10 miles or so.
Okay. Does your knee bother you right away when you start to run, or does it get worse as you run more?
After a run is when I feel it the most.
Okay.
I can run, feel pretty good on it. Once I stop, that's when I start to feel the discomfort.
Okay. Any other activities that seem to bother it? How are you doing with stairs or squatting or things like that?
Squats are good. I will say deep squats, I can feel a discomfort in that medial side. Okay. And that's like full range of motion deep squat. I can feel a pinch or a discomfort.
Yeah. All right.
Yeah.
So we've got some terminology going there because we've had a knee injury in the past, right?
Oh, yeah.
So talk to me about that. What have you had for knee injuries and surgeries?
Yep. So senior year of high school, which would have been 2016, I blew this knee out, tore my ACL meniscus, had it reconstructed, went through rehab. I retore my ACL. Got that reconstructed, and I retore my meniscus. So 3 procedures on this knee after high school.
Okay. And so that's 7-8 years ago.
Yep.
Okay. Now, does your knee ever buckle on you? Ever give out when you're walking, running, changing directions?
Yep, it can give sometimes. Yep.
Do you feel like it gives because of pain? There's a discomfort, and it kind of gives out, or it feels like it's a little loose and sloppy?
I would say loose.
Okay.
Yep.
All right. And do you take any medication for this knee?
Over the counter, Aleve sometimes, just to manage the pain. But it's sometimes short-lived. But like I said, mostly hurts the most after using it quite a bit.
Okay.
Yep.
And no recent diagnostic imaging, X-rays or MRIs or anything like that?
None.
Okay. So what we're going to do is we're going to put you on the table here. We're going to take a look at it. First things first, I want just to show everybody what your knee posture looks like. So I'm going to have you stand right up. And I'm going to put that back there just for now. And so we're going to take a look at his knees, and you can see here that we have a little bit of valgus going on both sides. We have just a little bit of pronation on both sides. I think you're also wearing Tread Labs insoles to help keep those arches supported. Mm-hmm. That seems to have been helping as far as your leg posturing so. And your endurance during the day. So if we take a look, you can kind of see a little bit of a kind of a predisposed knee type of posture here that could run him the risk of having an ACL issue. So what we're going to do now is we're going to have you on the table, but I'm going to pull it ahead just a little bit right there. All right, so I'm going to have you hop right up here. We're going to keep this leg down all the way. And what I want to do here is I want to just take a peek and see how well you straighten that leg out. And so we lack a little bit of extension here. We notice that there's some spring at the end. It doesn't hit the table really easily. I'm going to give him a little hyperextension. And he does have that hyperextension. That feels okay. Mm-hmm. Any pain with that?
No pain.
Okay. Now, how far can you bend your knee? Okay, we got about 130 degrees. How about if I give you a little bit of overpressure? Any pain there?
No pain.
Okay, good. All right. Next thing I'm going to do is I'm just going to take a look at your kneecap, see how well it's moving. So I'm just going to move that kneecap inward. Usually that's the most limited motion. Any problems there? Nope. And I'm going to poke around on the outer side of that kneecap, supralateral especially. Any pain in here?
Nope.
Okay, that's the most common area to have some lateral patellar compression syndrome or patellofemoral pain or maltracking will come out to the side. When there's suppression, reflex inhibition, and there's a quad shutdown, the VMO is the first to shut down. Therefore, the kneecap will track laterally a little bit more, and it's very common to see more supralateral discomfort in the knee. So we have good patellar mobility, medially, laterally, superiorly, inferiorly. I do get a little bit of crepitus here. Okay, so we'll assess that in just a second. Next thing I want to do is I just want to take a feel for each knee to see if one is warmer than the other. And this right one is a little bit warmer than that left one. We also have, we're going to check to see if we have an effusion in this knee. And I'm really not getting a brush test, although I feel a little bit of puffiness on this one compared to this one, okay? So just maybe a mild effusion in his knee. Let's go ahead and just do a little bit of ligamentous testing, okay? So first thing I want to do is assess your ACL. I'm going to do a Lockman test. I want you to relax your leg. So we have a lot of motion here, and I don't really have a nice endpoint. Okay, so we have some, probably a stretched ACL. The next thing I want to do is let's just do a modification. He's got a pretty big leg. So we're going to do this. And I don't have a very firm endpoint with that. Okay, so I assume we've got some either stretch or tearing of that ACL. Next thing I want to do is check the medial aspect of the knee. I'm going to do a valgus stress test at 0 degrees, and I have no instability or no gapping. I do it at 20 degrees, 25 degrees. There's no gapping there either. I like to get in on the leg like this to do the lateral side. So I'm going to give a little bit of pressure at 0 degrees. It's lateral capsule. That's nice and stable. A little flexion here. That's nice and stable also. So we have no obvious signs of medial or lateral, capsular, or collateral instability. We're going to check his PCL. I'm just going to do a little posterior drawer here. Nice and stable. There's a great endpoint there. Okay. Next thing I want to do is I want to assess his joint line. So I'm going to start here at the tibial plateau. I'm going to work my way down. Tell me if you have any discomfort when I do that.
A little bit in there.
A little uncomfortable right in that medial joint line. How about back here? Not bad. I like to go to the popliteal space, kind of work my way around. Any pain in here? No obvious signs of a Baker's cyst. There's not a lot of fluid in there. I'm going to now get back to the lateral side of his tibial plateau, and I'm going to do what I did on the medial side. I'm just going to follow that plateau laterally. Any pain with that?
No.
Okay. Next thing I might do just to assess to see if he has any inflammation in that plica is I'm going to go just medial to that patella, a little inferior, and I'm going to go back and forth till I can strum that. Feels like a piece of al dente spaghetti. You feel that? Right there?
Yep.
His is a little thickened. Is it painful?
It's not painful. No.
Okay, so not painful, but a little bit thick. I would compare it to the other side, and this one's a tiny little thing. So obviously he's had some irritation to that medial side of that capsule in that MPFL area, and I see just a little bit of inflammation there because it is a little bit warmer. There is a little bit more fluid in there. Next thing I want to do is I want to put a little pressure on that medial joint line to see if that medial meniscus is an issue. So I'm going to flex him. I'm going to put a little bit of a varus stress on the knee. I'm going to take him out like this. Any pain with that?
No pain.
Okay. And now I'm going to do just the opposite. We're going to compress that lateral joint line and meniscus. If I go to the end range of flexion, we're stressing the posterior horn. When I straighten him all the way out, anterior horn, any problems there? Okay. All right, so no real big irritation there. So next thing I want to do is I want to have you tighten up that quad. I want to see how well you can tighten it. Does the heel come up? And it does, so he has really good extension here. As you can see, we have the heel coming up, knees touching the table, and we've got a nice quad. Okay, so that's a bonus right there. All right, so I want you to go ahead and relax. I'm just going to give you a little bit of pressure here, and I want you to retighten that quad, but very slowly, okay? Go ahead and do that. No pain with that.
No pain.
And there wasn't all that much crepitus with that either, okay? So that's good. All right. So at this stage of the game, I have to be somewhat concerned with, some ACL laxity, possibly because, he's had 2 ACL tears. He's going to start to have some degenerative changes in his knee, and really more because he's had some meniscectomies, and so he's probably starting to break down a little earlier, starting to get some medial joint line discomfort. Quads are good. He has good range of motion here, good flexion. Those are all good things, okay? The sense of instability is probably coming from this either stretched or torn ACL. I am going to do a little pivot shift here with him just to see what that looks like. And because this has been quite a while, he should do okay. And relax here. Just let that leg go. All right. So what happens here is that it's not snapping in as quickly as I would like. You feel that big clunk at the end?
Yep.
That means that the ACL is stretched out and or torn, and we are having this screw home mechanism isn't happening at the right time and smoothly. We're getting to this point of extension and then it's snapping into place. So one more time, you can take a look. You'll see what happens here. It kind of happens right at the end. So that is definitely a concern. I think that the ACL is probably either partially torn or completely torn. And I think there's some underlying arthritis starting. I don't really appreciate a meniscal click or anything like that. There's not a lot of locking with the knee. So that would be my suspicion. At this stage of the game, we keep these quads really strong, hamstring strong, calves strong, lateral hip, glutes, keep that all in check. Now, you can go ahead and sit right up. Now, I know you want to run. I know you have this marathon coming, or half marathon.
Yep.
And really, to be honest with you, if you're going to be running on a pretty level surface, there's nothing wrong with you continuing to train and run, okay? As long as you're not on a lot of uneven ground where your knee could become unstable, I think that you're fine to continue to do that. At this point, if you feel like there's a significant amount of instability, maybe it's giving out a little bit more often, your knee is starting to bother you a little bit more, then we take a look at diagnostic imaging. But at this stage, I don't think we would change anything of what we're doing. Probably just be super careful with pivoting and twisting with a planted foot. And other than that, I'd say strengthen that leg as much as you can. So that's kind of the scoop on Brandon's knee here today, and hope you enjoyed today's evaluation. There may be a few things that I might have missed out there, but we did not rule out a nerve root compression in the back and things like that because we're just not having any of those symptoms. And sometimes we would throw out those questions about tingling and numbness and that type of thing, but that we established that before this visit. So I hope you enjoyed today's video, and if you did, please give us a thumbs up and be sure to subscribe. Thanks.